Welcome back to the Dr. K call. Today we are going to discuss knee implants. As you can see here on this skeleton, um, the end of the thigh bone and the end of the shin bone, and then this is your kneecap in the front. Most of us are bow-legged, so we wear it out on the inside. Some of us are knock-kneed, so we wear out on the outside. And some of us just wear out over time because of injuries, ligament injuries, things that have happened to us. So there's environmental causes like injuries. There is genetics. Some of us are made this way. If you look on a soccer field, you'll see all the young kids run around, and many of them are bow-legged. So most of the population tends to be on the bow-legged side. At any rate, this is you can see this is a natural knee, and the end of the thigh bone, the end of the shin bone, and the kneecap. So what we have to do is replace it, and what we have is not as good as what God gave you, but what God gave you has kind of worn out over time. So if we look at a partial knee, and here's a model of a computer-assisted robotic one, and you can see the lines as to where we were gonna actually make the cuts. And you can see that it's a very minimal resection with a partial knee. And most of them are the inside. So there's two kinds of partial knees. There's a mobile bearing. So this is what the part that goes on the end of the thigh bone or on the shin bone. This is the part that goes on the end of the thigh bone. And then this is the bearing in between. And by mobile bearing, we mean that this bearing can move. So as you go into flexion and extension, the bearing moves, and you can do rotation. So it is very much ligament driven and ligament balanced. So that's a mobile bearing. A fixed bearing means that the bearing is fixed. In other words, same type of concept. This is on the tibia or the shin bone. This is on the femur bone, and you're then moving it like this. So that's flexion and extension. And again, these are just replacing the inside. So from a bone standpoint, you can see, and this is again as a model, this is the part that we've resected, so that bottom part actually fits in there, okay? And the femoral part fits up top here, okay? And you can see that we then have the shim that goes in between those two parts, and this then restores the balance of your knee. So because of where you were bowed, and now we can get you back to a more normal bow, and we save your ligaments, your medial collateral, your lateral collateral, and the two ligaments in between your anterior and posterior cruciate ligaments. Now, moving on to a total knee. In a total knee, we're going to resurface that entire area. So on this bone, we're going to resurface all of this, all your thigh bone, and all of your shin bone. So if we look at these implants, they are much bigger. So here's an implant that's resurfaced the entire end of the thigh bone, and this is the implant that resurfaces the entire surface of the shin bone. And then this is the plastic, or the high molecular polyethylene, which is very dense plastic that goes in between, that then serves as the pad or the shim between. And we're able to correct deformities by making those cuts. Now, if we go on further, this is an example of a more constrained device. In other words, here you've sacrificed the ligaments on the inside, and you maintain only the outer ligaments, and sometimes even those are compromised. So this is a clunkier knee, and if you feel, you've seen some people with total knees, and you move the shin back and forth, you can hear it clunk, and that's what's making that noise, and it gives you side-to-side stability by the peg, this big peg in the center. So that peg is what makes the noise, and these knees tend to be a little clunkier. Stems are to get better support, usually because of bad bone and because of ligament instability. And then the last thing is a hinge knee. And a hinge knee is a knee that is tied together. In other words, it does not have the freedom. So it basically is a hinge that's locked together. So there's a lot of stress on these stems, both top and bottom. This particular one also rotates on the tibia, so it does reproduce some of those type of things. So those are the different types of knee implants, and thank you for watching.